a very nice woman who had some incredible knee pain. And exam and x-rays did show a fairly advanced osteoarthritis of the knees. And she did receive a number of treatments prior to visiting us, none of which really produced any significant or lasting results. When she came to see us, we did a full person evaluation, part of the Vinton Method. During the course of her examination, of course, we agreed that she did in fact have a mid to grade 3 osteoarthritis of her knees, something that we can readily help with functional and regenerative medicine. But in the course of our expanded examination, we also determined that she had a significantly dropped arch in her left foot, that every time she would walk would cause a mild buckling of that joint, further aggravating it. So if we didn't address it with a custom fit orthotic, she would continue to have trouble with that joint now and in the future. As we continue the evaluation, we did a leg length evaluation by digital x-ray and determined that one leg was in fact 14 millimeters. That's actually a little bit more than a half inch longer than the other. Now, this isn't the traditional when you see the chiropractor, oh, one leg's longer than the other. It's not like you can grow a leg length. Now, you can relax a muscle and the hips can drop. But if you got off their adjusting table, walked around the room and lay back down, if you have a truly short leg, it'll be short again because the bone length is different. So 14 millimeter shortness certainly contributes and will continue unless we solve it to her chronic knee pain. But the most important finding, we noticed when we did a neurological exam that she didn't have much strength in her legs, didn't have much strength in her feet. That's an ominous sign. That usually means that there's some kind of stenosis. Now, the interesting part, and for her, but not for us, is she kept saying, but I don't have any back pain, not even some. Doesn't matter. We have the neurological signs, right? Only 11% of people have pain. 89% have a functional issue that hasn't reached the pain stage yet, as evidenced by loss of strength, loss of mobility, loss of feeling, loss of reflexes, all of which she had. So we did an x-ray, and sure enough, it showed some significant degenerative changes, which warranted a lumbar MRI. The results of that came back today. She has end stage, what they call Cauda Equina syndrome. And what that means is they call the ending of your spinal cord. It's wrapped tight like a cable. At the very end, down below your belly button, all the way down to your tailbone, it spreads back out like a horse's tail, thus Cauda Equina, equina like equine, like horse. And what happens is the spinal canal is so closed over, in her case, thankfully, by discs and thickened or degenerated ligaments, soft tissue issues that are still able to be solved are closing off the hole to such a degree that the nerves and the spinal cord can no longer fit down the hole, thus causing severe compression on the nerves and leading to the weakness in her thigh, weakness in her foot, and the throbbing pain in her knees, which would explain why the other treatments had little effect when just treating her knees alone. So by adjusting the entire kinetic chain, we're able to get to the root cause. In addition, we ordered some pretty elaborate and extensive lab work that included inflammatory markers and check on her metabolic function. We all know that increased inflammation eats away at the cartilage of the joints, reduces the oxygen into the discs, which can cause accelerated degenerative disc disease or spinal decay. So by addressing the whole person, no questions about it, we're going to help her get better, but more importantly, stay better, because we've addressed the underlying causes